Hello and welcome. Today we're diving deep into a very common, yet often underestimated injury: nasal fractures, or broken noses. We'll explore everything from what causes them to how they're treated, so you can better understand this condition. So, what actually causes a nasal fracture? The most common culprits are blunt force traumas. Think falls, especially in children, or sports injuries, where a ball elbow or another player might connect with the nose. Motor vehicle accidents are also frequent causes, as is interpersonal violence, such as getting punched or kicked in the face. Anything that delivers a significant blow to the nose can result in a fracture. Now, let's look at what happens inside when the nose breaks. The nasal structure is primarily made of bone and cartilage. When a strong force impacts the nose, it can cause these structures to crack, shatter, or displace. This disruption can lead to bleeding, swelling, and difficulty breathing through the nose. In severe cases, the nasal septum, which divides the nasal cavity, can also be damaged, potentially causing a septal hematoma, a collection of blood within the septum. The nasal mucosa, the lining of the nose, is often torn in the process as well. Nasal fractures are surprisingly common. They're one of the most frequent types of facial fractures, particularly among young adults and athletes. Men are more likely to experience nasal fractures than women, likely due to higher participation rates in contact sports and other high-risk activities. The exact incidence varies depending on the region and population studied, but it's safe to say that nasal fractures represent a significant percentage of emergency room visits related to facial trauma. How do you know if you've broken your nose? The signs and symptoms can vary, but common indicators include pain and tenderness to the touch in the nasal area. Swelling and bruising around the nose and eyes are typical, often referred to as black eyes. You might experience a nosebleed, difficulty breathing through your nose, a visibly crooked or deformed nose, and in some cases, a crackling or grating sensation when you touch the nose. Clear fluid draining from the nose could indicate a more serious skull base fracture and needs immediate medical attention. Diagnosing a nasal fracture typically involves a physical examination by a healthcare professional. They'll assess the shape and stability of the nose, look for any visible deformities or bruising, and check for any septal hematoma. While X-rays were once commonly used, they are now often reserved for more complex cases or when other facial fractures are suspected, as they often don't provide much additional information. A CT scan may be ordered if there is suspicion of other facial injuries or a more severe fracture. Nasal fractures can be classified based on the location and severity of the break. Some common types include linear fractures, where there's a single break in the bone, comminuted fractures, where the bone is broken into multiple pieces, and displaced fractures, where the broken bones are out of alignment. In addition, we can describe the fracture based on location such as septal fracture, lateral wall fracture, or involving the frontal process of the maxilla. Treatment for a nasal fracture depends on the severity of the injury. For simple, non-displaced fractures, pain management with over-the-counter analgesics like ibuprofen or acetaminophen and ice packs may be sufficient. Displaced fractures usually require reduction, which is the process of realigning the broken bones. This can be done either with closed reduction, where the bones are manipulated back into place without surgery, or with open reduction, which involves a surgical incision. A septal hematoma requires drainage to prevent cartilage necrosis and subsequent nasal deformity. Sometimes, a splint is applied to the nose to stabilize it during healing. While you can't completely eliminate the risk of a nasal fracture, there are steps you can take to reduce your chances. Wearing appropriate protective gear during sports, such as a face mask or helmet, is crucial. Using seatbelts in vehicles and avoiding situations that could lead to violence can also help prevent these injuries. Fall prevention measures, especially for children and the elderly, can also reduce the risk of nasal fractures. The prognosis for a nasal fracture is generally good, especially with prompt and appropriate treatment. Most people recover fully without any long-term complications. However, if the fracture isn't properly treated, it can lead to chronic nasal obstruction, persistent nasal deformity, or septal perforation. Recent research focuses on improving techniques for nasal fracture reduction, minimizing complications, and developing more effective pain management strategies. Advances in imaging technology are also helping to better diagnose and classify nasal fractures, leading to more tailored treatment approaches.